Hello and welcome to the Wellness 52 presentation for the November 2020 UTA presented by the Airmen and Family Readiness Center. My name is Master Sergeant Derek Tarosa. If you're here for the first time, Wellness 52 is a program we created earlier this year, and our mission is to engage members of the 514th Air Mobility Wing with tools, activities, and resources that improve personal well-being, encourage professional development, and increase quality of life. Our vision is that improving the well-being of the 514th Air Mobility Wing will enhance morale and maximize potential, leading to increased resiliency and mission readiness. Wellness isn't something you do once a UTA, once a month, or once a week. It's a 52-week commitment. It's a total lifestyle change. And our goal with these programs is to expose you to healthy habits that you can use for yourself and share with your family and friends and loved ones to improve your overall quality of life and mental, physical, emotional, spiritual. We're covering all the different topics. Today specifically is part 3 in our series related to Fit to Fight. The first part was physical fitness. The second part was nutrition. And lastly, today we're going to focus on rest and recovery, a critical component to increasing your performance is proper rest and recovery. And we'll focus on that today. Thank you very much for joining us. Just a quick disclaimer, the content in this presentation is for informational purposes only, and it's not intended to be a substitute for professional medical advice, diagnosis, or treatment. The views expressed are those of the author and do not reflect the official policy or position of the U.S. Air Force, Department of Defense, or the U.S. government. Table of contents, we will discuss what rest and recovery actually is, the importance and benefits, how to monitor and measure your recovery, overtraining symptoms and solutions, recovery tools and techniques, sleep tips, and we'll conclude with nutrition and supplements. In 2011, a study compared 2 groups of individuals. One of them slept 5.5 hours per night, while the other got 8.5 hours of sleep per night. Then researchers found that those who slept for a shorter period of time lost less fat, 55% less fat, and not only that, they lost muscle mass, 60% more muscle mass by the end of 2 weeks, a very short time frame. So as you can see, the quantity and quality of your sleep matters. Rest and recovery, what does that mean? Rest is passive. Rest is defined as inactivity. That means no exercise. It means limiting your physical activity. It can be relaxing, meditating, sleeping. On the other hand, recovery is more active in nature. It's the tools, techniques, and methods you use to return your body to a better state. That involves light activity, cross-training, very low intensity, low impact aerobic exercise, keeping your heart rate low. It can involve stretching, yoga, heat, ice, and compression. And we'll get into this later, the benefits of many of these things. Massage, and then of course, nutrition. Rebuilding, refueling, and rehydrating your body. Why is it important? We can break it down into the physiological benefits and the psychological benefits. In terms of physiological benefits, it allows your muscles to repair, rebuild, and strengthen. It helps eliminate or remove lactic acid and get rid of metabolic waste. It gives your body a chance to replenish its glycogen or energy stores. That's the fuel your body uses to function. And it also gives your nervous system a break. Your nervous system, the communication link between your brain and your muscles, it's constantly working. You need to give that a rest as well. In terms of the psychological benefits, it means balancing your home life, your work life, and your fitness goals or your personal goals. You want to keep these items in balance. If any one item becomes out of balance, it's difficult to compensate the other areas in your life. And it's not good for your overall health if one of these areas is out of balance. It improves your clarity, determination, and focus. When you give your mind a break from exercise, it helps improve your mood. It helps you refocus your goals and increase your motivation. So you have to give your body a break physically and mentally. If not, it'll lead to burnout and overtraining, which we'll get into later. What is supercompensation theory? This is a theory that basically says a training stimulus results in fatigue. Rest helps your body recover and restore itself to a better and enhanced future state, which is the supercompensation phase. And as you see here in the first chart, the x-axis is time. In the bottom left-hand corner, you see the Goldilocks principle. Basically, it's saying essentially the same thing. You have a training stimulus. You encourage your body to undergo physical stress, at what point the muscles get broken down, your body gets taxed, and that's when the recovery and repairing and rebuilding phase occurs, which leads to performance gains. In the bottom right-hand corner is a very interesting example of two different cyclists. Cyclist A incorporates rest and recovery into his or her training schedule, while cyclist B is determined to keep working out harder and harder and pushing the volume, the intensity, the frequency of the workouts, not really incorporating many rest days. What happens is the cyclist gets into a very deep deficit. The body is overly taxed, and at the end of the same time frame, the cyclist who incorporated rest days, now granted, the cyclist A is training less and resting more versus cyclist B, who's training more and resting less. And at the end of the time frame, what happens is that cyclist A realizes an increased fitness gain compared to cyclist B. So less training is more. How do you monitor and measure your rest and recovery? There's several scientific methods you can utilize as well as qualitative methods. In terms of scientific methods, sleep. First and foremost, encourage quality and quantity of sleep to be at a high level. That means getting at least 7 hours per night of sleep. Sleep can be broken down into light sleep, deep sleep, and REM sleep. REM sleep, that's that dream state. Preferably 50 to 60% of your sleep will be light, 10 to 25% deep, and 20 to 25% REM, or the dream state. Respiratory rate, 13 to 18 breaths per minute is encouraged. Obviously, you can't control this. The bottom line is your respiratory rate should be consistent. Now, in order to track this stuff, you typically need a smartwatch or a fitness tracker to determine the amount of light, deep, and REM sleep you're getting per night. It's good to keep a diary, and essentially in that diary, what you should do is kind of monitor your nutrition, monitor your exercise, monitor your alcohol consumption, caffeine consumption, and see how that impacts your sleep, the quantity and quality of your sleep. That way you can make adjustments based on what's working and what's not working. Resting heart rate, a little bit more simple and something you can do without a high-tech device. It indicates body stress. When you're undergoing enhanced stress, whether it's physical or mental, your resting heart rate will be higher. What you want to do, and I encourage you to do this tomorrow morning, is to take your heart rate. First thing in the morning, you're still laying down in bed. How many beats per minute? You can use, there's some phone apps that you can use, or you can just simply put your hand or your fingers on your pulse, on your wrist, and count how many beats per minute. You can count how many beats per 30 seconds and multiply it by 2. What you want to do is what you're going to do is do that every morning for a week, kind of determine your average. And that's a baseline. Now, as you increase your fitness, that should lower over time. A lower resting heart rate means enhanced fitness. You're more athletic than if you were to have a higher resting heart rate. It also can mean other things. It can mean if your heart rate, a good way to look at whether or not you need to incorporate more rest and recovery into your training routine is to determine if your resting heart rate is higher than usual. Once you get this average heart rate, for example, if your heart rate is usually 55 beats per minute, and then suddenly you see it creeping up to 56, 57, 58, 60 beats per minute, that's kind of in the 10% range, where it probably means your body's undergoing more stress than it can handle. So what I would encourage you to do is to cut back on your training, whether you cut back on the volume or the intensity, lift weight, run less, take a whole rest day, take a few rest days, and then monitor that heart rate and make sure it goes down to that baseline, that average. Another thing you can do with heart rate, which is pretty cool, is to determine your heart rate recovery. That's how many beats it's lowered in the first minute post-exercise. Now for this, you need to get your heart rate up to the 80 to 90% range of your maximum. And if you go back to our presentation a few months ago on physical fitness, you'll learn how to calculate your ranges and things like that. But this is a good indicator of your overall fitness level. Great fitness would indicate a heart rate that is lowered by 30 beats or more per minute post-exercise. Good 20-29 and poor 14 to 19. For example, if you just did a 800 meter sprint and your heart rate is 165 immediately following. Now, a minute later, your heart rate gets down to 135. That's excellent. 135 or better, excellent. That means you're in very good shape. You're in great physical condition. Now, on the other hand, if your heart rate only gets down to 150 after a minute, that probably means you're not in as good of shape as you could be, which is good because that's a goal. You can use that as a marker, and you can use that as motivation to get your heart rate down to a better range, which would be the higher the better. The higher your heart rate can recover, the better you are in terms of your physical fitness. Heart rate variability is a little bit more difficult, but it's very useful and it's becoming more trendy now. You need a very sophisticated device to track your heart rate variability. It measures your autonomic nervous system, which is broken down into two parts, the parasympathetic branch and the sympathetic branch. The parasympathetic branch, that's often referred to as your rest and digest. It handles inputs from your internal organs like digestion and other things like that. The parasympathetic branch is responsible for decreasing your heart rate. On the other hand, the other branch is called the sympathetic branch. That's probably the one you've heard of most often. It's that fight or flight. It reflects responses to things like stress and exercise. It's responsible for increasing your heart rate. The parasympathetic branch decreases your heart rate, and the sympathetic branch increases your heart rate. The point of this here is the heart rate variability is a measure of these two systems, how they interact with each other. And it measures the variance in time between heartbeats. A high HRV means your body's optimal, and it means the body is balanced because the body can easily adapt to the situation, whether you're in a relaxed state or whether you're in a more stressful state. A higher heart rate variability means there's more variance between the heartbeats. It means your body is properly functioning, it's firing on all cylinders, it's ready to go. Meanwhile, a lower HRV means your body's struggling to switch. It's struggling to switch between the two systems. It means you're undergoing an enhanced level of stress, or fatigue. Now, your HRV varies based on many things. Based on your nutrition, what you put into your body, based on the quality and quantity of your sleep, among other things, lifestyle factors, illness. Believe it or not, one thing that was found during COVID is that heart rate variability can be used as a tool to identify COVID symptoms, COVID illness, because a lower HRV is a symptom of illness or infection. Very interesting. Here's a nice chart that shows you what your heart rate range should be based on your age and your gender and your fitness status. Athletes have lower resting heart rates. Your body doesn't have to pump as hard. The stroke volume, the volume of your blood is greater. Your body doesn't have to pump out more blood because with each beat, more blood is circulated through your system. That's why a lower heart rate is generally an indicator of someone who has a high level of fitness and more pronounced in cardiovascular, more pronounced in runners, endurance sports than someone who is more into strength training or weightlifting. And of course, women have higher heart rates in general than men. And then younger people have higher heart rates than older people. The other thing you can use is qualitative factors to measure your rest and recovery. Your workouts is the easiest. The rating of perceived exertion is something we discussed in the physical fitness presentation. It's your perceived effort. How difficult was the workout? If your usual workout is more difficult than normal, if you struggle to maintain the same pace, if it just feels harder in general, if you're lifting less reps for the same load, if your heart rate is higher for a given pace than it was before, a few weeks ago, or last week, a few days ago, it probably means that your body needs time to rest because it's just too worn down. So these are indicators that it's probably time to cut back on the volume, frequency, or intensity. And then this chart here to the right is just more key performance indicators you can use to kind of identify if your body is struggling to perform at a high level. Many of these items will be disrupted. Frame of mind. This is very critical as well. How's your mood, your motivation, your concentration, your focus? If these things are altered, it probably means that your body is not getting enough rest and recovery. Same thing with the state of the body. Muscle soreness that doesn't go away, that lingers. Same thing with illness and injuries. If you're more susceptible to getting colds, that's a sign that your body's not fully recovered. You have to cut back. Recovery times are slower. Your sleep quality is poor. All of these things are indicators that it's time to rest. It's time to give your body a break. The further you keep training, and it's difficult, sometimes it's difficult to take a rest day. You don't want to, you want to keep training, but you're not going to see results. You get results when you're resting. Your body doesn't get results when you're training. It's that recovery and rest phase that helps restore, rebuild, and enhance your body to get stronger, to get faster, to get more efficient. Listen to your body. When you dig yourself into a deeper and deeper hole, it results in overtraining, which is a very serious condition that can lead to chronic fatigue. It leads to loss of performance. Many of these items, which was previously discussed, excessive soreness, trouble sleeping, loss of appetite, mood swings and irritability, frequent illness, elevated resting heart rate, depression or lack of motivation, memory problems, poor concentration, increased aches, pains, and lingering injuries, all signs of overtraining, which is a very detrimental to your overall physical health and performance. This training response here, undertraining means you're not training hard enough. You're not pushing your body hard enough to gain results, to see results. You have to, progressive overload is necessary to achieve results. And then once you get into the overreaching, overtraining phase, it's critical that you really tread cautiously because it's hard to overcome a severe deficit. When your body is fatigued from overtraining, it's really hard to get back to that normal state. But for the general population, I don't think overtraining is something to be too worried about. It's more of an issue for people who are elite professionals and training for 10, 12 or more hours per week. Solutions to overtraining. Incorporating rest days, of course, the easiest thing to do. Alternating easy and hard weeks. That means for every 3 weeks of hard training, you should typically take 1 easy week. Cut back on the volume, cut back on the intensity, cut back on the frequency in that easy week or that recovery week. And then you can ramp things up against the following week. And you'll be surprised. You probably find that your workouts are easier. Your rating of perceived exertion is lower for the same given workout after you take a rest or recovery week. Eat enough calories. A lot of times people who are interested in changing their body image will restrict their diet, and calorie restriction is not good. It's better to take the long approach than to try to get short-term results really quickly because you're just going to deplete your body. Your body needs fuel. It needs those calories for fuel to perform. It needs those calories to maintain muscle mass and to shed fat. Believe it or not, if you restrict, you probably notice this, if you restrict your calories, you retain more fat and you don't build as much muscle than if you were to properly fuel your body with enough calories, and especially carbohydrates as well. Carbohydrates get a bad rap, but carbohydrates are necessary to build muscle. They're necessary to perform anaerobic exercise, we discussed in the nutrition program. Decreasing caffeine stimulants. If you're overtrained, your body's undergoing a lot of stress. The last thing you want to do is overload it with stimulants, because that's just going to increase your cortisol levels, your hormone that releases adrenaline. It's not good for your body. Schedule active recovery, as we discussed. Increase protein intake. Protein contains those vital amino acids that are used to rebuild the muscles. Sleep more. The quantity and quality of your sleep. We'll get into tips in a little bit. Get enough carbohydrates, as I discussed. Practice yoga and meditation, great for mental stress relief as well. Avoid excessive alcohol. It doesn't really do your body any good. It disrupts your sleep. It raises cortisol as well. It's a good idea to cut back on excessive alcohol, especially. Recovery techniques and tools. Just a little bit more specifically as it relates to recovery, some of the tools you can utilize. Active recovery, as we discussed, low impact, light aerobic exercise, cross training. If you don't have a personal massage or masseuse on hand 24 hours a day, you can buy a foam roller, which is just as good. Not really, but the vibrating massager, the foam rolling, those things are great because they help relax the muscles, release tension. They get blood flowing to the muscles, helps them restore themselves, increase circulation. You can use Epsom salt, which is a great component of magnesium. Magnesium is good for reducing muscle spasms, helping relax your muscles as well, and it's really good for just relaxing your body in general. A nice warm Epsom salt bath will really make you feel relaxed and is very beneficial. Ice baths, if you have the courage to do ice baths, those are great. They really are better than heat therapy is cold or cryptotherapy. You might have seen those chambers now they got these days where you have, you go in the chamber and it's super cold, but it's great for your muscles. Basically what it does is it restricts blood flow. If it restricts blood flow, it makes the blood flow away from your muscles. So then what happens is when you get to a warm environment again, new blood rushes in. And this new blood invigorates the muscles with a fresh set of blood that is what they need to repair. Fresh set of blood increases circulation and nutrients so that your muscles can repair. And then compression is good for reducing muscle soreness, same kind of thing. All these things basically help circulate blood through the muscles and through the body, which helps them speed up recovery. Post-workout nutrition, we discussed it a little bit last time, but just to reemphasize, because it really is critical to refuel, rebuild, and rehydrate your body post-exercise, especially in that first 30 minutes. You want to consume carbs and protein in a 4-to-1 ratio. As I mentioned, it's the only time where you're allowed to have high glycemic foods. That's that sugary treats, fruit, sports drinks, high sugar content items. Fast digesting carbohydrates to get those nutrients right in the muscles real quick. Replace lost fluids. You should weigh yourself before and after you work out, especially if it's hot and humid and you're outside sweating. You want to drink 16 ounces of water for each pound of sweat loss, as well as electrolyte consumption, 500 to 700 milligrams of sodium for every pound of sweat loss. Some items on the left chart, just really quick and easy and convenient post-exercise. Lack of sleep, so critical, sleep to performance, brain function, illness and infection, your immune system, physical capabilities, vigor, motivation, focus, and your tactical performance as it relates to sport-specific skills. Here are some tips. Have a set schedule. Go to bed the same time every night, wake up the same time every morning. It gets your body on a loop, a rhythm. Your body will get used to this schedule, and it'll make you fall asleep more easily, and you'll wake up more easily. You'll probably wake up before your alarm goes off. And I know it's hard to do, but especially on the weekend, try to stay within a tight range of when you wake up and go to bed. It'll make a huge difference on Monday morning. I guarantee that. Take a warm shower. Warm shower helps relax you before bed. I'm going to add some wet Epsom salts, do a bath. Really gets your body into a relaxation state, helps you fall asleep more easily. Eliminate blue light exposure. This is a big one with smartphones and with TVs and electronics. They have blue light. And blue light, it suppresses your body's ability to release melatonin, which is the hormone that puts you to sleep. Now, several solutions here. You can buy a pair of funky looking glasses, or you can download sometimes phone and computer. They have these apps that changes the light exposure from blue to something else that's more suitable for pre-bedtime activities. Or you can just abstain from electronics, which is probably the preferred method. Reduce caffeine consumption. Caffeine stays in your body for a long time, 6 to 8 hours after you last sip. So you want to limit this, and you want to avoid consuming caffeine after 3 p.m. Do not exercise before bed. It releases adrenaline, it raises your heart rate, raises cortisol, and as a result, it's probably difficult to fall asleep when your heart rate is raging due to exercising close to bed. Optimize your bedroom environment. Make your bed the place for sleeping. Make your bedroom convenient for sleeping. It helps to avoid watching TV in bed, eating in bed. Bed should be for sleeping. Set the temperature to 67 to 70 degrees. Studies shown that this increases the quality and quantity of your sleep, a cooler environment. Don't eat too late, and also don't go to bed hungry. Avoid alcohol, it disrupts your sleep. You'll get inconsistent sleep. You will not get deep sleep. You'll be more in the 70 to 80 range of light sleep, 10% range deep sleep, and 10% range REM sleep. Overall, you're going to wake up not feeling well rested, even though you probably got the same quantity of sleep. It's that category. Alcohol disrupts the category. Try essential oils. Lavender is really nice. It's relaxing. You can put 1 to 2 drops on your pillow. As a last resort, you can try supplements. Melatonin you can take externally. Magnesium you can ingest as well, and that helps relax, just like the Epsom salt bath. L-theanine too, it lowers cortisol and stress, and it provides you relaxation. But again, be very careful with this, and please consult your physician. Here are some supplements that enhance recovery from exercise. Glutamine, it's depleted when you work out. So replenishing it through an external source is helpful. It helps your muscles retain water and repair. It boosts your immune system as well. Magnesium, as we discussed, it promotes muscle contraction, relaxation, and protein synthesis. It also prevents the buildup of lactic acid. Most people are deficient in magnesium, and so it's good to incorporate into your diet, especially if you exercise a lot. Turmeric is great. It's a very powerful antioxidant and anti-inflammatory. Studies have shown that it's just as powerful as ibuprofen. It reduces muscle and joint pain. I've been using it for several years now, and I used to get some knee pain from running, but ever since I started using turmeric, it's just done wonders for my body. Tart cherry juice as well. It reduces oxidative stress. It helps your muscles prevent muscle soreness. It promotes the production of melatonin, so it's also good for sleep. Ashwagandha is an herb that helps lower cortisol. That's your stress hormone. It helps with anxiety, depression, and mood. This is a really interesting article, which I encourage you to check out when you have a chance. It talks about how COVID kind of altered the training schedules of a lot of elite athletes due to just the situation with For example, the Olympics being canceled and many sporting competitions being delayed, postponed, or canceled or done virtually. So these athletes, they haven't had to travel as much. They've had to cut back on training because gym closures, swimming pool closures. And as a result, their performance didn't suffer. It actually was enhanced. And a lot of them broke their own personal records as well as world records this year in 2020. Believe it or not, due to less training and more rest. And it essentially sums up this whole presentation on the importance of rest and recovery. When you get a chance, check it out. And then just to wrap things up, if you haven't done so yet, please join the Strava Club. Strava is a social network for fitness-minded individuals, and we created a 514th Air Mobility Wing Fitness Club. You can register at strava.com/register, search for 514 AMW, and you can join the club, inspire a wingman, and be inspired. Thank you very much. That concludes the presentation for this month, and as it relates to rest and recovery, part 3 in our series of Fit to Fight. If you have time for a brief survey, we'd really appreciate it. Just help us improve this presentation moving forward. You can visit the link there, SurveyMonkey. If you're interested in any personalized fitness and nutrition advice, please email hello@midlifeathlete.com. I'd love to help you out. PowerPoint slides can be found here as well. The infographic consolidates a lot of information that we've discussed in the last 3 sessions as it relates to Fit to Fight, physical fitness, nutrition, rest, and recovery. If you're looking for some inspiration, please visit midlifeathlete.com. It's an initiative I started earlier this year to encourage people to partake in endurance sports during COVID. And some really inspiring stories out there. People have overcome injury, illness, addiction, and the benefit and enhancements that participating in athletic endeavors have resulted in just extraordinary gains in their lives. For example, individual 2 weeks ago with Down syndrome became the first person to complete an Ironman, and his story's on there. And just some really nice stories during this time of year, especially when sports have been impacted based on the pandemic. And then lastly, a fitness and nutrition guide for you can check out as well. Well, thank you very much for being here today. Really appreciate joining us, and please reach out with any questions or comments, and look forward to seeing you next month. Thanks very much. Take care.